in the media love the charts of cases. They're dramatic, they're emotional, they're the easily countable. The pros look at deaths and hospitalizations. When would you assume the public will finally shift onto your territory of death and hospitalization dynamics?
I think they're already starting to, as they see that people are getting vaccinated, as they don't hear about hospital capacity problems anymore, as they realize that nursing homes have been vaccinated. I think they're starting to understand that the concept really is not to get to COVID zero, but to tame the virus, to defang it so that it doesn't have the ability to cause serious disease, hospitalization, and death. And I think they're going to get there, because eventually that's all everybody's going to be looking at, because this is what flattening the curve has always been about, is being below hospital capacity. And if you're in that position, we're dealing with a very different virus than we were a year ago. And I think that it's going to take some time, and the media is going to have to report more on that than they are on cases, and it's going to be a shift. But I think it is going to occur, and it is starting to occur.
Doctor, as more attention is drawn to that, people will ask whether we can aggressively broaden the eligibility for vaccinations. Do you think we're at that point right now?
I do think we're starting to see states get broader. We've heard about Alaska broadening. There's other states that are now broadening eligibility. It's just a question of being supply constrained right now, and the supply is going to get better. Each day it gets a little bit better as we get closer and closer to delivery dates for Pfizer, Moderna, for Johnson & Johnson, for bigger amounts of this vaccine. So I do think it's going to be a point then we're just vaccinating in anybody that wants to be vaccinated, as the president said, can make an appointment in May. And I think we're looking at summer, hopefully a little bit earlier than that, late spring, where that can be the case, because that will really get things completely back on track, and we'll see the clear trajectory out of this pandemic.
Doctor,
it's already
sensing
right?
frustration among certain people, including myself, and I'll be very open about that. The idea that smokers in certain states have seemed to jump the line. A choice to smoke has given you the opportunity to get a vaccine before people who have chosen not to smoke. What's the best way of dealing with these issues?
You have to remember that the vaccine is about really decreasing the pressure on hospitals by vaccinating high-risk individuals. So when we look at this as a public health problem, they were trying to say, how can we stretch this vaccine supply the best so that our hospitals never get in trouble? So if you're a smoker, you're more likely to be hospitalized. So it's not any kind of personal approval of your behavior. It's just your behavior puts you at risk for severe disease. We're worried about hospital capacities. We're worried about ICU beds. So we're going to give you a vaccine so hospitals don't have to worry about you. That's how I put that to people in the act.
Dr. Adalja, in the meantime, over in Europe, you have a growing number of countries suspending the use of the AstraZeneca vaccine. What's your view on the efficacy of this particular inoculation and whether it ought to continue to be distributed?
I think it should be continued to be distributed. We've seen tremendous success in the United Kingdom with this. It's actually approved in Canada as well. This is a vaccine, uses innovative technology. I think they've had some difficulties with the EU, difficulties with dosing, and now there's been some reports of blood clots, but they're not above the background rate that you would expect in a population that's been vaccinated. And I think this is just one of those spurious associations, and people need to be explained that just because something happens after a vaccination doesn't mean that it's been caused by the vaccination.
Okay, we're going to stop the show. This is really, really important, Dr. Adalja. Are you telling us that the uproar in Europe, nation to nation, about the AstraZeneca vaccine is overdone, or the uproar is off the mark or incorrect?
All of the above. I don't think that this is justified. Other countries like the UK have not suspended this association with blood clots. Everyone has looked at the data so far and has said this doesn't look like it has a biological mechanism. It is not above the background rate of what you would expect in a population that big. And this is something we see with vaccines. When you give them to large populations, certain things happen. It doesn't mean it's caused by the vaccine. It's important to look, to understand, and try and figure that out. But I don't think in the midst of a pandemic where people are dying, where many European countries are going into lockdowns, that a vaccine that's been proven to be highly effective in the United Kingdom should be suspended. I think it's the wrong decision.